We're going to do some passive range of motion testing on Ryan today. First, I'm going to talk about the motions of the shoulder. So in flexion and extension, as well as internal and external rotation at 90 degrees, the shoulder moves along the sagittal plane around the coronal axis with horizontal abduction and adduction, as well as regular internal and external rotation of the shoulder. The shoulder moves along the transverse plane along the longitudinal axis. And with abduction and adduction, the shoulder moves along the coronal axis, or along the coronal plane along the sagittal axis. So let's begin with internal rotation, first testing the uninjured shoulder and then the injured shoulder. So tell me which one hurts.
This is the one that hurts.
Okay. So putting him into internal rotation, the end feel for the uninjured shoulder is a soft tissue stretch. The end feel of the injured shoulder is a soft tissue stretch as well, with a slight limited range. I'm going to get you to lie down with your head over here, please. Okay, head over there. Perfect. Okay, so I'm just going to test passively his range of motion on the good shoulder, or uninjured shoulder. First, into extension, just because he's already there. Let me know if anything hurts or feels uncomfortable, okay?
You got it.
Okay, so the end feel for extension is a soft tissue stretch. Soft tissue stretch in flexion as well. Just bend your elbow, relax your shoulder. Internal rotation feels like soft tissue stretch. External rotation feels like a soft tissue stretch. Horizontal abduction or adduction feels like a soft tissue or tissue approximation. Soft tissue approximation. Horizontal abduction feels like soft tissue stretch. Now it's hard to do adduction, so we'll do hyperadduction of the shoulder. And I get a soft tissue approximation with that. And horizontal abduction, we get a soft tissue stretch as well. Or actually more of a soft tissue approximation. So that was 1, 2, 3, 4. And last one. Regular external rotation feels like a soft tissue stretch. I'm going to get you to flip over with your head on this side, please. Perfect. Moving you into flexion. Feels like a soft tissue stretch. Just bend your elbow. Relax your shoulder. Extension feels like a soft tissue stretch. Bend your elbow. Internal rotation at 90 feels like a soft tissue stretch. Does that hurt?
Yes, hurts there.
Okay, and on a scale of 0 to 10, what would you rate that?
I'd say it's about 7.
Okay. So that's during external rotation at 90. There's pain. And it feels like it's limited in terms of range of motion, but we'll test that with a goniometer. Test external rotation as well.
A little bit.
What's on a scale of 0 to 10?
About a 5 right there.
5?
Not as bad, yeah.
A little bit of 5, okay. Not as bad. That's good. Okay, horizontal adduction, feels like a soft tissue stretch. And the external rotation also felt like a soft tissue stretch. I could get to the end feel for that one. Horizontal abduction, feels like a soft tissue stretch. Hyperadduction, feels like tissue approximation.
Ow.
That hurts?
Yeah.
And on a scale of 0 to 10?
About a 7 as well.
7?
Yeah.
Where?
Out here.
Same spot?
Same spot.
Okay,
Ow.
it gets there. Okay, so I couldn't get an end feel there. I know, okay. Okay. But we will test the range of motion with the goniometer. Okay, then. So in order to test flexion with a goniometer, I will align the fulcrum along lateral to the acromion process. The stable arm will be parallel to the torso, the midline of the side torso. And the moving arm will be centered along the midline of the humerus. So at flexion, Ryan's at 170 degrees. Flexion. And we'll move him into, to test external and internal rotation with a goniometer at 90 degrees. The stable arm of the stable arm of the goniometer will be perpendicular to the floor. Fulcrum will be on the olecranon process, and the moving arm will align with the midline of the forearm of the ulna. Okay. So with pain, due to pain, he can't move into further external rotation, and that leaves us at approximately 70 degrees of external rotation at 90 degrees, or yeah, that's right, at 90. And then with internal rotation, Ryan's at about 45 degrees. To test abduction, I will align the fulcrum anterior to the acromion process. The stable arm will be parallel to the torso of the body, the midline torso, and the moving arm will be centered along the midline of the humerus. So I'm going to push you into abduction.
Ow.
Okay. So Ryan feels pain at 170 degrees of abduction. So seems to be slightly limited compared to his uninjured side. Based on the passive range of motion testing and where we find the pain, I suspect that he may have rotator cuff tendinopathy, particularly the supraspinatus, because he is in pain during abduction and external rotation. It could be possibly a bicipital tendinopathy as well. However, there would be more pain during flexion and there was not any pain found during flexion. Also, a sprain of the transverse ligament that crosses over the bicipital or the long head biceps tendon. Yeah, it could be sprained. However, there would be pain with extension and as well with external rotation. So yes, thank you for watching.